Hi, my name is Jasmine Pinter. I'm a counselor and life coach at Ignite with my master's in social work. This week I'm going to talk about something a little bit different, a little less counseling related, and probably, well, it is connected to what I do working as a medical social worker in a hospital, but I thought this could be helpful for folks that are looking for a residential care setting for their older parent, grandparent, aunt, uncle, somebody that they care about, in order to better assist that person with the needs that they have. Sometimes this happens after numerous hospital stays. Sometimes it will happen after a diagnosis of an illness, or as memory fades for older adults that may have dementia or Alzheimer's. And at other times it can happen after accidents with major cognitive or physical limits after recovery. Sometimes it can also just happen for the period of time that's needed for healing and recovery, and a person may end up returning home. So I work with all of those situations at the hospital, and often folks are wondering, where do I start? There's several levels of care, and I'll be talking about in my community, and most communities have some sort of these levels of care. Some specific communities may have some things that have a range of these levels of care, and some have only one type specifically. So for an instance, a hospital is acute care for somebody that has medical instability and needs medical attention. After a hospitalization, a person may need inpatient rehab, which is in my state 3 hours of therapy, and that's at least 2 of the 3 therapies: physical therapy, occupational therapy, and speech. A doctor comes in every day. It's in a hospital setting. There are nurses and CNAs, social workers as well, that work with this person, and generally then that person is going to discharge either home with family, or to a foster home, or a residential care setting that's maybe less intense than rehab, but a longer term plan. So memory care, or a long-term care setting where folks are there to help with meals and possibly some in-home caregiving as well. So the inpatient rehab is the next level of care. The reason a person might not be able to do that is that they don't have the endurance for the 3 hours of therapy each day, or their insurance doesn't cover it, or they don't have one of those destinations in place. So they don't have somebody that can be with them for a period of time after hospitalization, or they don't have a foster home or residential care setting that they can go to. If inpatient rehab is not an option, another option is skilled rehab, and that is at a facility that has a medical director that oversees a large staff that has nurses and CNAs. And then there are also physical therapists, speech therapists, and occupational therapists. But the major difference is this is 1 hour of therapy each day. Based on a person's need for therapy, insurance authorization, and motivation to go on to the next phase determines the length of stay. The average length of stay is generally 2 weeks. But 20 days is common, and a lot of Medicare folks will have up to 100 days within a standard year. What often with certain managed care, you have to prove that a person is gaining progress with therapies each day and hasn't reached their baseline. So that's being able to take care of their daily living skills: feeding, walking, bathing themselves. And after this kind of stay, often a person will return back home. But they also may, stay at that residential care facility for long-term care, where they're not receiving those therapies anymore, but do still get meals prepared and may have some level of care as far as getting ready for the day. And that person may also go to a foster home in a smaller group setting where they live in a private home of somebody that has gone through the state regulations to get certified to provide care for a certain number of individuals in their home, or a memory care facility where they specialize in working with adults who have memory issues. So a long-term care facility can be a place, and that's, I think, kind of the grayest area. So a long-term care facility can be at a skilled rehab where they provide beds for folks that live there for a long time. And like I said, they then a person pays for room and board. They'll have nurses and CNAs there, but most of their care is just making sure that they're dressed and well fed, and they may participate in outings with the residents there, but they're there for the long haul. There's other facilities that are only residential care, and so they're long-term care facilities that will have at least one nurse on site, some CNAs, and other staff there. And so those, some of them may specialize in mental health settings, some of them may specialize in memory care, and some are just there for folks that need just a little bit more care than living home alone. So the confusing part with this is then the next two types of settings, which is assisted living versus a retirement community. And all of these residential care facility, assisted living, and retirement community often get interchanged, but they are different to some degree. And often with assisted living, so you'll have your own apartment, a locked door, a place you go to, you'll have a small kitchen. And some assisted living facilities have other levels of care there as well. So you can hire your own private caregivers to come in and take care of you. You still may have a community room where you can go eat with folks. So I guess in that regard, it's a little, generally folks that live there are a little bit higher functioning. They can still take care of themselves, but they need to be in more of a community setting where there are people there if something forbid happens. A retirement community is similar to assisted living, but there's not generally a nurse guaranteed on site. There will be potentially staff, but again, it's your own apartment. It's like a 55 and older community, which is where you have the availability for socialization with other elders. And so any range of these can be paid for privately and or through Medicaid, which is what we have here in Oregon, and that's income based. You have to apply for that based on, generally you're not having more than $2,000 in savings, you don't have a large amount of assets, likely you may not own a home anymore, and so there's some other caveats with that. If you have more money, then a trust can be built, but often from the hospital we're requesting those for folks that need a higher level of care, may not have family in town, or don't have family that can leave work for periods of time, and that person's not safe home alone. So I should go back also with a residential care facility. Sometimes folks still hire private caregivers there as well, and sometimes those private caregivers are paid for privately, and sometimes those are also added as a benefit with Medicaid. So those are the types of settings that folks can look at when they're trying to figure out where their loved one would be. When people come to me asking, how do I pick a place, that can be difficult because as a employee of our hospital, we're not supposed to recommend a place or not, but we do tell people to go to Medicare, medicare.org, because facilities will be rated based on their following regulations and complaints against them, whether those were founded or unfounded. And so if you go to that Medicare.gov, you can see how well a place is ranked compared to others. Then I generally will tell folks to try to pick, 3 places based on the level of care your loved one needs. Choose 3 of the same level of care. So if they're going to a skilled rehab place, I'll ask them to try to pick 3, and 3 that are somewhat close to family. what's been proven is that people do better when families visiting often or friends, and it doesn't and that can make the biggest difference. One, because if a person's not being cared for, they can come and talk to staff and ask for special, or I shouldn't say special, but ask for the care to be elevated, or maybe it's a personality conflict, issues with roommates, because often in some of the skilled nursing facilities or long-term care facilities, a person may have a roommate. And the other piece is that just kind of adds a human face, human story to the person that's there, so you're a staff member and you're caring for a patient, and you start seeing their mom and dad and sister, maybe nieces and nephews, and you start gaining an understanding of that person's culture, the dynamics between the family, and maybe even a better understanding of how you can care for them better. So that's why we generally tell folks to try to pick a place that's easily accessible for the family members that are most involved. I often tell folks not to warn facilities, quote unquote, that they're coming. This is just because you want to know that at any given time that somebody's being well cared for. And so if you come in and are ready to look around and get a tour, you'll see how welcomed you are by staff, paying attention to how the folks that live there are. Are they smiling? Do they seem content? Are they well fed and well cared for? And then, a lot of this, I think, is intuition. Is it a place that you feel like your loved one can feel at home? Do they encourage people to bring personalized things to the room? Are they asking questions that you feel are appropriate? Do they tell you who to connect with to help with discharge planning, or who to go to if there are concerns? What's their protocol for contacting family if there is a medical emergency, or even just some change in the behavior of your loved one, and then also just what's available for the community. So what kind of events do they have? What kind of socialization do they have? And does that match with what your family member or friend would enjoy doing? So with all those things in mind, then for skilled rehab, insurance will cover that. Sometimes there is a copay. For a long-term care facility, then you want to, kind of get into the nitty-gritty, which is how much is this going to cost, and how, what do you need to put up front for a deposit, etc. For skilled facilities as well, sometimes you can request a private room. Some facilities only have private rooms. Sometimes you're put on a list for a while, so you may go in sharing a room, and then after a week you can get your own room. So those things are all things to consider. Some people are very private, and having a private room is really important, and other people kind of like the companionship of getting to know others, or are surprised that because it's a short stay, maybe it's not that bad to have to share a living quarter for a short time. So I think that about covers my general spiel when I'm talking to family members about how to choose a place. And this is a hard thing to do. It does help if you have more than one family member making a decision together, because if this is a long-term place, then you want to know that this is going to work. I guess I should also say, with longer-term care facilities, often they will do assessment of your family member, and there's an interview that goes both ways. So you're interviewing them about what they do, what they could provide, and they're interviewing you about your loved one, and they're trying to find out, is this going to be a good fit even for foster homes? They'll find out if they feel like that person's personality is going to meld well with the folks that live there already. And that just helps in the long term with, because it's a new household. It's like a family. So I think that's it for this week. I'm sorry I haven't posted a video in a couple of weeks, but it's been busy here, and I appreciate all the likes and shares of this video, and encourage you to comment or suggest any other topic ideas. I'll probably pick something more counseling related next time, but I thought this was a good topic to cover because, one, I didn't have to use a script today because I do this all the time, talk about this topic every day at work. And two, I think it's been beneficial actually for some of my clients as well in my private practices. They take care of their loved ones. So take care, and I'll see you next time.